It is my pleasure to introduce Tom Ballard. You all picked up his credentials and the topic that he's talking about, but I'm going to read this to you because I'm not sure everybody had a chance to pick everything up. So what you want to know is Tom is a naturopathic. He has been in scientific natural medicine since 1982. Right? He graduated from Ballard in '82, and currently he is the owner of Pure Wellness Centers. Right? That's it, purewellnesscenters.com in Seattle, where he consults with patients on complex problems that are specifically chronic health problems. In 2013, he founded Natural DNA Solutions, the world leader in providing comprehensive genetic-based health reports for doctors and patients. He's the author of Nutrition 123 and numerous articles on natural health. He has also developed a number of health-related videos on his YouTube channel, Tom Ballard MD. But this is the thing that's very cool. My approach from Tom is to treat the whole person with natural therapies, emphasizing treating the cause, not just the symptoms. Please symptoms are like fire alarms, don't ignore them, but don't mistake them for the fire.
Thank you. Do you always sit so far away, or is this something that I should take personally? So what I wanted to do today was give you a little introduction to genetic testing and how it applies to your skin. And this may or may not be on your radar yet, but it's going to be. This is a very big thing I think in healthcare in general and in medicine. This is, I think, analogous to 100 years ago when we were first discovering bacteria and figuring out what was going on with infectious disease. The next big thing of that magnitude in medicine is going to be about genetics. So you're going to be hearing about it. You're going to have your clients coming in and talking to you and asking you questions about it. So this is basically a little introduction so you have some sort of basis to talk to them about it. Let's see if I can figure out the system here. I graduated, as she said, from Ballard in 1982. If you don't know about naturopathic medicine, I think there's the little bit of confusion that goes on here is that a lot of people think that naturopathic medicine, we go to four-year medical schools like Ballard and we do anatomy and physiology and biochemistry and that sort of thing. But rather than looking at drugs and surgery, we're looking at natural therapies. And I think the confusion here comes in is, well, what is natural? I mean, it's a very abused word in our society, right? To me, natural means figuring out what the underlying cause is. Not just saying, oh, you have high blood pressure, let's give you a drug that lowers it, but to say, why do you have low blood pressure? Because you're high blood pressure. Because your blood pressure may be high because you're high in mercury, or yours might be high because you're under a lot of stress, or yours because you're low in magnesium. There's lots of reasons that it will affect people's blood pressure, their cholesterol, their skin, their stress levels, and et cetera, et cetera. And I think the really best medicine is the medicine that looks underneath and says why, and then treats that as an individual. And that's one of the exciting things about genetics is naturopathic medicine and holistic doctors have always looked at treating the patient, not the disease. It's the patient. We're all different. We all manifest things differently. What genetics does is it allows us another level of specification and treatment. So what happened is that you probably heard about the Genome Project that basically mapped the human genome. That was about 9 years ago. What's happened since then is rather remarkable. In the last 7 years or so, companies have come out, and you can now do a lab test to look at your own genetics for $100. I mean, when you go from this multi-million-dollar project to map the genome to being able to do a home saliva test for $100 is really quite remarkable. And I want to be talking specifically about that. As mentioned, I'm the author of Nutrition 123, available at your better bookstores and Amazon. So what is genetics all about? Well, you know, our eyes tend to glaze over when we hear about this, but basically genetics is all about heredity and what gets passed on. You know, what you got from your parents, what your parents got from their grandparents, what your grandparents got from your great-grandparents, et cetera, et cetera. And you don't inherit everything, but you inherit certain traits. And there are certain traits that are, you know, really obvious, like eye color, hair color, temperament sometimes. They get passed along from generation to generation. But there's also a lot of subtleties that aren't so obvious. Like, for instance, your ability to make estrogen. And then, on the other hand, your ability to break down estrogen. You need estrogen, but you also need to break it down, and that's under the control of genes. And neurotransmitters that affect your mood, vitamins, minerals. We'll get into this in a little more detail. This is all under genetic control. And I think that if there's one really, really important message today, is that genetics is not destiny. We tend to think, you know, my mother had this, my father had this, every generation has had a cancer or had diabetes, so I'm going to get it. There's this sort of fatalistic prognosis that tends to go along with genetics. But the fact of the matter is that that's absolutely not true. One of the things we found out at the Human Genome Project is that we are still 50-50. You know, there's always been this age-old debate of, you know, what is it? Genetics, you know, what is it? Nature or nurture was the old argument. You know, we're just born bad, we're always going to be bad, as Woody Allen would say, or can we modify that by how we live our lives? And this is the science of epigenetics. Epigenetics says what happens to our genes after they've been presented to us. In other words, what do we do with our genes? And there's a number of analogies. One analogy would be that genetics is like the blueprint. You know, you want to build a house, you go to an architect, they draw out a blueprint. But you still have to saw the boards, you got to measure the boards, you got to pound the nails. And so there's a lot of things that are going to determine how that house turns out. It's the same thing with your genes. You can have great genes and have lousy health and vice versa. And this is a sort of a stark example of this idea. These are two genetically identical mice. They are actually bred to be, have diabetes, to be obese, and they get a lot of cancer. So two genetically identical mice, but they've been fed different diets. The mouse on the left has been given its sort of typical mouse chow laboratory feed. The one on the right has been given a special, highly nutrient-rich diet. And you can see the obvious differences. Not only is the one on the right normal size, but his coat has returned to the normal coat color, and he's free of diabetes, free of cancer. And this same thing applies to human beings. These are identical twins. What's the difference? Why did one of these end up having cancer and the other not? It's because of what happened in their lives. And sometimes we can trace this, sometimes we can't. Some life events happen. Stresses, toxins, poor diet, you know, living across from factories, et cetera, can change our genetic expression. So to me, this is like the real take-home message here. It's more important than anything else, because we keep hearing this over and over, even from doctors, that, oh, well, you know, everybody in your family has this disease, you're going to get it too. But the demonstration in real life is that that's not necessarily true, and we can change that dynamic. So I was thinking about this when I was putting this together, and you know, you are all epigenetic practitioners already. You are already doing things to change people's genetic So I came up with this little way to think about this sort of for my simple mind, in that the three things when you look at people's genetics that come up over and over are detoxification, nutrition, and activity. And activity meaning both mental and physical activities. This becomes detoxification D, nutrition N, activity A. Those are your DNA that support your DNA. And over, when you look at people's genetics, which I've been doing for about 1.5 years now, you see these come over and over. This person can change their genes. They can turn off their negative genes by doing some detoxification or doing some stress reduction or changing their diet. So we've all seen the differences in what kind of effects this can have on the skin. This is, again, not only a difference in genetics, but a difference in lifestyle. And the other point that I think it's helpful to kind of synthesize and simplify this idea of what genetics is that genes only do two things that you need to keep in mind. Genes make proteins. So your DNA is basically churning out protein. And there's two types of protein. One of them is structural proteins, such as collagen that you're very familiar with. And the other type of protein are enzymes. Enzymes perform functions in our body. We know about digestive enzymes that break down food, but we have millions of enzymes in our body that are basically carrying out different functions. They're manufacturing neurotransmitters, they're manufacturing insulin, they're breaking things down, and that's all that genetics does, making proteins. And this is just a little diagram of how that works, which we don't really need to get into, but they're just little machines for churning out proteins. And what you inherited was a message in here that said what your protein should look like. Not necessarily how they're going to turn out, but what the blueprint is for them. I think this is a really helpful model to look at. We hear a lot about serotonin. It's a neurotransmitter that has to do with mood. So we hear it's been sometimes called the happy hormone. There's many drugs that increase serotonin levels. But if you're looking at it from a more holistic point of view and saying, gosh, I need more serotonin, I want to feel better, then how do you work backwards and say, well, how can I get to there without actually taking a drug? And when you work backwards, you say, okay, serotonin is made from protein. So I got to eat some proteins. That protein then has to be digested. This is one of the reasons we emphasize digestive health, because you want to break it down into your amino acids. Tryptophan being one of many amino acids. And then here we go with an enzyme. So this is a genetically determined enzyme. It's going to turn that tryptophan into 5-HTP, which is just a modification of the tryptophan, and then another genetically determined enzyme that turns that into serotonin. So this process, though, doesn't work alone. We need what are called coenzymes, or sometimes they're called cofactors, which are basically vitamins and minerals. Each of these enzymes needs some vitamins and minerals to support it. So there's where the nutrition part comes in. So try to imagine a scenario where genetically somebody has really lousy enzyme here. They don't make this conversion very well. But what if they support it with the vitamins and minerals that are needed to help this process? They might be able to overcome that poor genetics. Not to gloss over your eyes, but this is just an idea of how all of this works. We know that these enzymes have to have these cofactors. So let's say that what we have there is some, I hate to harp on this over and over, but let's say we have some estrogen that needs to be broken down. So in order to break down that estrogen, it has to be affected by this enzyme. That enzyme needs that vitamin or mineral cofactor in order to fit there and make this reaction happen. So what do we have when we look at the skin specifically about genetics? Well, you've got, you know, the multi-layers of the skin, you've got the protein metabolism, you've got fat metabolism, you've got carbohydrate metabolism, because, you know, if you're not metabolizing your sugars very well, it will show up on your skin. The skin will actually excrete sugar in it. Free radicals, you know about free radicals and oxidative damage. It's a very big deal in the skin industry. Detoxification and reducing inflammatory products, reducing excess hormones, and then we have vitamins, minerals, other nutrients that are all part of this genetic influence on our skin. And there's just another way of looking at this. I think what's really important about this is particularly, you know, this phospholipid layer here. These are phosphorus, this is fat. So fat is very, very important for our skin, right? And these tend to be proteins that are kind of floating around inside this phospholipid layer. And those proteins are part of the process of basically communication. It's either moving things out of the cell or moving things back into the cell. So again, we're talking about if you want to have really good quality skin, you're not just working on this layer, right? You're working on all of these layers. You have a supportive muscle layer down here. You've got the fats. You've got to have good quality fats. And then you've got the stratum up here that's basically these dead cells that are being given off on the skin. But these dead cells all are dependent for both for support and for their livelihood on these layers down here. This isn't a nutrition lecture per se, but one of the things I talk about in my nutrition lecture is these fats here are determined by the fats you eat. You know, if you're eating McDonald's hamburgers, you're going to have McDonald's fat in here. If you're eating fish oil and good quality nuts and seeds, you're going to have a whole different layer of fats in there. This is this idea that, again, it isn't just skin deep. I mean, our first glance when we look at a slide like this is to say, wow, look how great that skin looks. It's all, you know, there's none of this coloration in there. But if you look at it for another minute, you say, wow, there's also not as good a muscle support in here. There's probably not as good a fat support in here. You know, these blood vessels rely on those muscles and fats to support them. Obviously, you can get some swelling in the joints, inflammation. So it's really the culmination of all of this that gives us our presentation of skin to the outer world. It's not just that surface layer. So the discoloration comes when you have fragile blood vessels, which need vitamins and minerals and collagen support. When you don't have supported blood vessels, they break easier. And if you have poor circulation, you're going to have more of these distended vessels. So for instance, if you're not exercising, not doing things to get your blood circulating, the vessels are going to start to distend. You know, a little more microscopic view of this. Here's where our really important collagen fibers come in. Collagens are a type of protein. Where does protein come from? All protein is made by your DNA. It's churning this stuff out all day. So any kind of cracks or wrinkles in your skin are going to be caused by a breakdown of this collagen and the supporting tissue underneath. This is just this idea that how important vitamins and minerals are. I go back to this idea of the cofactors. If you're deficient in vitamin E, it's affecting every organ in your body, and it's going to manifest on your skin. If it's manifesting on the skin, of course, you're going to want to look inside and see what maybe destruction of blood vessels, cardiac problems, blood sugar regulation, and other things also may be affected by that low vitamin E. That vitamin E in turn is affected by how much vitamin E-rich food you're eating, but also how well your genetics process that vitamin E. Another probably more familiar example is vitamin D. So we all know that if you spend a certain amount of time in the sun, that sun interacts with the cholesterol on our skin and produces vitamin D. Well, that's not the end of the story though. That vitamin D has to go into your liver, and some more enzymes, which are under genetic control, take that vitamin D and turn it into a more useful, viable kinds of vitamin D that affect not only your skin, but also other factors in your body. One of the sort of a simplistic way of looking at this is that we have vitamin D receptors. So anytime you talk about vitamin E receptors, estrogen receptors, testosterone receptors, these are basically proteins that are programmed by genetics. And in order for vitamin D to do its work, we're pretending that is vitamin D, it has to attach to a receptor. So in that earlier slide where we were talking about that layer where we have the phospholipid layers and then proteins that are floating around in there, well, some of those are receptors so that your vitamin D can actually get the message into the body. Once your vitamin D is in your body, then it can go and does all sorts of wonderful things. You know, for many decades when I was in school and up until about 15, 20 years ago, we only used to talk about vitamin D and calcium and bones and how that affected bones. Now, you know, you can read all sorts of wonderful articles about how it affects the central nervous system, it affects the immune regulation, hormone secretion. For instance, your thyroid depends on vitamin D to do its activity in the body. And then, of course, the skin and hairs are affected by that vitamin D receptor, which again, just to repeat myself, is under the control of your genetics. So when you see these kind of graphs like this, I think they're kind of interesting. You know, you look at, okay, here's Seattle, here's San Diego, how much time do you have to spend in the sun, how naked do you have to be in order to get enough vitamin D? You know, and so they're talking about, you know, if you're only have your face and hands exposed, you may be having to spend as much as 504 minutes a day, you know, to get enough conversion of vitamin E and vitamin D into your body. Whereas if you're in shorts and you got more skin exposed, it's only 84 minutes. Now, what these kind of charts are, I think, interesting and helpful, but what they overlook is the genetic part of this. Because you might have really good vitamin D receptors being controlled by your genes, or you may have lousy genes. So you may find that 84 minutes is enough to get your vitamin D up to the 35 level. That may not be enough if you've got lousy receptors that are actually transporting this D into your body. So a person with lousy vitamin D genetics, they may need to keep their vitamin D up to 50 or 60 when it's measured on a blood test. Whereas somebody with really great genetics, they might get away with a lower amount of vitamin D in their body and still be healthier. And just as a little reminder about this whole issue about free radicals and oxidation, I think we see over and over, if we go to health food stores, look on the internet, we're always reading about antioxidants, right? Well, what do antioxidants do? And these are the antioxidants that you put on people's skin or the antioxidants that people eat. Well, what they do is they stop free radical production or what's called oxidative stress. And the analogy here is that if you leave a shovel out in the rain and the air exposure, it will start to rust. Well, that's oxidation for your shovel. If you leave butter out or fats out in the sun and the heat and the air, it will start to break down and go rancid. Well, that's oxidation. That's this breakdown process that gets started. And this is associated with all of our chronic diseases. You see it every day on the skin, but it's actually associated with diabetes, Alzheimer's disease, arthritis, all of these kinds of diseases. And basically what's happening is this not to get into the technical parts of this, but this oxidation process starts and it causes this chain reaction where electrons are cast off, and then you start actually eroding the skin or membranes. If this, for instance, is on your skin, then you're going to see skin breakdown and aging, premature aging. If this is inside of a blood vessel, inside of one of your heart vessels, then it's going to cause irritation and inflammation inside your heart, and then the cholesterol will come along later and start to build up to try to protect you from that erosion. And then it's the antioxidants that neutralize those. And again, not to get too much into the nutrition part of this, but one of the things I emphasize in my book and my nutrition lectures is there are hundreds and hundreds of different antioxidants. And they all do slightly different things in the body. So when you hear about a product that's the highest level of antioxidants in the world, you know, this miracle vegetable or fruit from, you know, the Amazon jungle, what you're talking about there is a plant that has a very high amount of 1 or 2 antioxidants. And that might be, you know, a good thing to take. But what about all the other thousands of antioxidants? So you really want to get, this is of course why we emphasize variety in our diets, so that you're getting a variety of different kinds of antioxidants. You're not just eating one kind of fruit. You're not just relying on pomegranate or something like that, your antioxidants, but you're looking at all of the fruits and vegetables and all of these different antioxidants and how they work in the body. Just another example, you know, this is oxidative damage. This is the side of the apple that was treated with an antioxidant. In this case, it was just lemon juice. Put some lemon juice on there, got some natural antioxidant effects. It prevents the breakdown. But imagine this on a microscopic level. Imagine this being your skin, you know, or your brain or some other organ in your body, and how these how these pro-oxidants are damaging. And again, this is going to all the different parts of our body, and we increase the amount of oxidative damage in our body when we have a poor diet, when we're exposed to pollution. Certain drugs do this, radiation, stress, injuries, aging, infections. These are all contributing to this total oxidative stress in our body. And then often, of course, the skin is taking the brunt of that. The point here is this issue about inflammation. When you're talking about antioxidants, you're talking about anti-inflammation. And inflammation, as you know, damages the skin. It also is linked to cancer, Alzheimer's, heart attacks, all sorts of other diseases. You can look at all of the chronic diseases that are so prevalent in our society now and link them back to a certain level of inflammation. So your epigenetic challenge is to help your clients institute anti-inflammatory, antioxidant kinds of therapies. There are blood tests that you can do in this more sophisticated laboratory, but a very simple thing that you can do is you can go to the drugstore and buy some pH paper, or recommend that your clients do this. And they do a first morning urine. I have them do first morning urine and saliva pH test for 5 to 7 days. So you get their average. And typically, I mean, this is not a foolproof test by any means, but it gives you a sort of a general idea. Generally, people who are more acidic, that are down here in the 5 and 6 range, are going to have more inflammation, more oxidative stress going on. You want to strive for that kind of neutral around 7, both for the saliva and the skin. Maybe slightly acidic. I said saliva and skin, I meant saliva and urine. You maybe want a little bit slightly acidic for the urine, but not way down here. And people will actually see this change as they start they'll do an initial one for a week, and then a month later, after taking antioxidants and taking, changing their diet and doing things, they'll notice that their pH will start to change. You're doing derma rollers on people, you're doing massage on people. Well, what is that doing when we're talking about genetics? Well, you know that you're helping to increase circulation. That's always good. You're increasing that muscle tone. You're increasing collagen growth. And you're even helping to remove toxins. So this goes back to that earlier slide where we're talking about all of the layers and how all of those layers, the muscle, the fat, and whatnot, help support the skin. Once you've done all of these things, then you've got to go, well, what else would help this person? Well, again, we go, are they eating enough protein? Is their digestion working? Are they taking antioxidants orally as well as getting them on their skin? Are they getting enough essential fatty acids? It's amazing how many people are fat deficient. We've had this sort of overly dramatic and not very scientific emphasis on low-fat diets that have actually made people essential fatty acid deficient. So people need to be getting a couple of tablespoons of fats, of good quality fats in their diets every day. Sulfur is really important, such as you get in Epsom salt locally, or you get in sulfur-containing foods, and always, of course, removing cigarettes, a huge factor on helping that skin regenerate. On the outside, but what's supporting that skin? And at the very deepest level, it's these bones. So if a person has osteoporosis, bone degeneration, and you of course see this over time when you look at people, then they're going to not have that kind of support that their skin needs to keep it youthful looking. And this is under genetic control, how well we process our bones, how well we get calcium into our bones is under genetic control. But we can epigenetically influence that by making sure the person's getting enough calcium-rich foods, magnesium-rich foods, vitamin D hopefully from the sun. We're having a great year for that this year. Reducing inflammation. Again, when I talked earlier about the Time magazine article about inflammation and how it's affecting, well, one of the diseases that's been strongly linked to inflammation is osteoporosis. I think most people tend to think of osteoporosis as not getting enough calcium and that kind of thing. But it's an inflammatory condition that actually causes breakdown of bone. Maintaining a neutral pH. Again, there's a lot of research on that pH testing for urine and saliva that women who have a more neutral pH tend to lose less bone. When you're highly acidic, the body tries to compensate for that. So it will take alkaline elements, such as calcium and magnesium, into the bloodstream to try to alkalize your system. Well, where is it getting that calcium? It's getting it from the bones. It's actually breaking down bones to try to alkalize your system. And then, of course, exercise is important. And, exercise, again, when we emphasize the face, I think it's great to go on the internet and talk and look at these articles that have been written about how facial exercise is actually exercising these facial muscles is important for ultimately having a more youthful looking skin. So what are you looking at when you look at somebody and just say, well, God, this person is really sort of dull, not very exciting looking skin? Well, you're looking basically at the loss of light reflection. That loss of light reflection is then the roughness feeling is caused by problems with the collagen. Think of the collagen, which again is the protein that's being generated by your DNA, which is the organizer of the skin. And if your collagen is disorganized, then you're going to get more pucker, you're going to get less smoothness, you're going to get less light reflection, and a duller looking skin. So what you do, of course, is you do skin peels and you remove that disorganized layer of skin, right? And you're hoping that the next layer that's coming up is going to be more organized. And you can actually help that by increasing the collagen health by using antioxidants, by using vitamin A, vitamin C, keratins, and other kinds of antioxidants. And so that you're better able to ensure that this new layer of skin that's coming up is going to be smoother. So acne, of course, I got several slides here on acne because it's such a big thing. I think that here's where we get in back to this idea of epigenetics, genetics. You will read studies on not just on acne, but on all sorts of other kinds of health problems saying, there's two studies here. Basically, they found that the difference was not due, the genes explain, well, it's simply put here, genes explain 81% of the difference in acne presence. So they're basically saying in both of these studies that if your parents had acne and you inherited these genes, there's a really likelihood, 81% in this case, of getting acne. Well, I hope you know that that's not true, right? Because there's these epigenetic factors that they weren't looking for in these studies. So when you look at epigenetics and acne, you say, well, Dr. Cordain, who is the discoverer of the paleo diet, says there's no evidence of acne in tribal societies. Well, they have genetics, the same genetics we do. Why don't they manifest with this acne? Well, it's because they're eating a different diet. It's also, acne is less prevalent in non-Western countries, and that people who go from non-Western countries to Western countries start getting acne. So that's a great example of how you start expressing your genes when you get under these kinds of influences. So diet, high sugar, lots of refined carbohydrates, lots of research directly implicating it with acne. Again, what I was saying earlier about if you have too much sugar in your body, your skin will try to get rid of that. And one of the ways it gets rid of that is through the skin. Well, you can imagine a scenario where this person has a lot of sugar coming out through their pores. What do bacteria love? They love the sugar, right? And they're going to thrive in there. You also, it's not, this is kind of the idea that it's more complicated than just, oh, I inherited acne or I inherited a certain condition from my parents. But you can also have hormonal influences by your genes. And we know that things like high testosterone can increase acne. So if you're either producing too much testosterone because you have very good genetic machinery to do that, or if you're not getting rid of the testosterone, then you're going to have more acne. And then there's the whole thing about inflammation. Genes influence inflammation and how that responds to the bacteria in our skin. And then we also know that the good and the bad bacteria in our gut and our skin influence the amount of acne a person gets. So these are all the sort of epigenetic influences there. The other thing when you talk about epigenetics and lifestyle stuff is that, most of us, or many of us also, especially when we're young, inherit eating patterns from our parents. So you might say, oh yeah, there's all this heart disease that we've inherited, but many people are also inheriting the same kind of lifestyle, they're inheriting the same diets. We tend to eat like our parents did, how they trained us to eat. So we will go and eat high sugar foods or bad fat foods and things like that we've kind of inherited from our parents. Changing this is to eat more vegetables, seeds, whole grains, legumes. Green tea actually will help block that. If you have excessive androgens or testosterone, it helps block that. And a small amount of coffee, not too much, will help reduce inflammation. So same thing, this is a pattern that we just kind of can repeat here. The same thing is happening with eczema. We know that there's some genetic influence with eczema, that it does tend to run in families. We know that there's some disruption of the immune system and more allergies in people who have eczema. But we also know that people who have environmental factors, such as live in areas with more air pollution. But what does air pollution do? You know, when we talk about good genes and bad genes, we all inherit these. Let's say you have a bad gene that's going to make you more prone to acne or eczema or heart disease. Well, one of the ways you can, which is really good at turning on bad genes, is environmental exposure to pollution. It tends to open up and turn those genes on. Whereas antioxidant foods, vitamins, minerals, detoxification tend to turn those genes off. And here again, we get into this thing where if you don't have a good skin barrier, which is essential fatty acids and zinc, then you're also going to be more prone to having these environmental influences trigger the eczema. So, skipping around here, I don't know, are many of you aware of autoimmune diseases and seeing it come into your practices? This is a very, very big deal. Autoimmune diseases used to be fairly rare. Now, something like 1 in every 2 women has an autoimmune disorder. Autoimmune things like lupus, Crohn's disease, chronic fatigue, Hashimoto's, which is a thyroid problem, scleroderma, celiac disease. All of these are under the autoimmune category, and many of these can affect your skin as well as your total health. These autoimmune diseases are more common in women. They affect everything. They can affect the trachea, blood vessels, esophagus, liver, ovaries, etc., and also the skin. So one of the things that's going to happen is that people are going to come in, and obviously you're not doctors, you're not diagnosing, but you need to be sort of alert to some of these conditions that are coming in. So you may have heard of lupus, and lupus, one of the most common presenting symptoms or signs of lupus is what's called the butterfly rash. So this woman comes into your practice and she's got this rash here on the side of her face. Is that lupus, or is it just a skin discoloration? You may or may not be able to make that diagnosis. Obviously, you got to send it to your doctor if there's any question about that. But you know, this is a skin discoloration that's caused by 2 melanocytes causing too much pigmentation. If you have a true lupus, then you get this butterfly rash that it isn't always this obvious, but you know, because her skin is so light and this is so dark, it's really obvious that she has this butterfly rash. And she very likely has never been diagnosed with lupus or any kind of autoimmune disease. She thinks that she's having a skin condition. She's probably breaking out with more acne. She may think this is eczema and coming to you and saying, oh, I got this eczema, I've got a lot of acne on my nose and in here. But if it's presenting in this pattern, then you want to look at this idea that maybe it's lupus or some sort of autoimmune disorder. This is just a picture showing how sometimes this can be more difficult to see depending on the person's skin color. For over 70 years, we have known that autoimmune disease is highly associated with a breakdown in the gut barrier, what we call leaky gut syndrome. You got disruption in the intestinal flora, which causes inflammation, oxidative stress, lack of glucose control, poor lipids, allergies start to affect, things like moods can because you get this inflammatory cycle where once the guts or the bowels are out of alignment, you start releasing these inflammatory particles, and this is basically the cycle of autoimmune disease. You get these things that may go to your eyes, it may go to your guts, definitely will go to your skin, even to your brain, and start affecting your mood. This is all part of autoimmune, you know. Autoimmune is just a fancy word for your body is attacking itself. For one person, it might be attacking the thyroid gland. Another person, it might be attacking the liver or some other organ. This is all part of that autoimmune process. And like I say, I think the statistics now are 1 in 2 women. It's now in the top 10 of chronic health problems. So this is an example of a disease that 50 years ago wasn't on anybody's radar. And that now, look how common it is. And you've got to ask the question, well, our genes didn't change. Our genes were set thousands, millions of years ago. Our genes haven't changed, so now why are we getting this disease that we know has some genetic influence, but there's more to it than that. And that more to it than that is all of these epigenetic factors. You probably heard, a famous story of the BRCA gene, the breast cancer gene, and women going and having their breasts removed because they're so afraid of having this gene and they have this cancer history in their family. Well, that's a very personal, decision that somebody has to make. But the overview is that, again, our genes haven't changed. That gene has always been around. So why is it that 50 years ago, it only caused a very small 2 or 5% increase in breast cancer, and now it's causing a 40 to 50% increase? It's not because the genes have changed, it's because the things that we are exposed to in our environment have changed. So that's kind of, hopefully not too confusing or rapid of an overview of sort of the genetics. I wanted to just talk for a little bit about, what do you do? Like if you want to get this done, or if a patient's done doing this kind of stuff, well, what's the procedure? Well, the procedure is that you send a package like this that has a vial inside of it, and you salivate into it. This is the most common. There are other tests available. The 23andme.com is the largest home provider of genetic testing. So inside here, there's a little vial. You salivate into it. You send it off to them, and they do a genetic analysis of your body for $99. Pretty amazing. You can do this anonymously if you're worried about government intrusion or something like this. You can use a false name. The problem with the test is that they will only tell you about your ancestry. They won't tell you about your health. So they will do a little analysis and say that you're 3.3% Native American and 81% Northern European, and et cetera, et cetera. So they're talking to you about your sort of ancestry, genealogy parts of things. And with that, you can choose or not choose to participate in groups. So there's groups that are, trying to find relatives and things like that. And you can turn that off if you don't want to, or if you're really interested in finding, more about your genetic heritage, you can do that. One of the reasons that 23andMe does this testing and does it so inexpensively is because they are trying to create a huge database. So they've done over 600,000 of these tests over the last 8 or so years that they've been in business. Originally, the test cost $1,000, then it went down to $250. Now, for the last year and a half, it's been down to $100. So they're gathering information about diabetes and Parkinson's and all these diseases to try to figure out what the genetic connections are. But what they give you has nothing to do with your health. It's only this genetics. So in order to find out more about your health, you basically have to take their laboratory test and send it to a third-party vendor who will then turn that into a health report. And there's a number of companies. This one I hear is really good. Prometheus, methyltetrahydrofolate support, as well. There's a number of companies where you basically send your raw data from 23andMe, and then they turn that into a health report. So one of the things I wanted to talk about is just what do you look for when you're looking at a health report? To me, you're looking for a test that has a large number of genes, and 23andMe does that. Not all of the health reports will do that, though. You want it organized. You want it explanation of the function. In other words, when you see on your test that your VDR gene is disrupted, well, you want to know that that's your vitamin D receptor gene. So you want an explanation of that. And then you want to know what you can do about this. In other words, like I was saying earlier, if your vitamin D receptor genes are not working so well or so efficiently, then you may want to be taking more vitamin D, making sure you're getting good sun exposure. And you know, you want to be able to focus this. So, for instance, you can do a test that only looks at one function. So there's a company that you can send out to, and they will just look at your mood. They will say, well, these are the genes that have to do with your mood. We're going to just test that. Or there are some out there that are just focusing on athletic performance. Or there are ones that are talking about methylation or detoxification. And these are all useful tests, but to me, they're way too limited. You really want to be able to look at all of these things. You want to look at how well you detoxify. You want to look at how well you metabolize alcohol. We were talking earlier about how alcohol can, both in small amounts, be good for you and excessive amounts be bad for you. Why do we get this confusing research? Well, because we have different genetics. Some people can handle alcohol really well, some not so well. Neurotransmitters, GABA, which is another neurotransmitters. This is a set of genes that helps you detoxify or get rid of your excessive amounts of hormones like estrogen. So you may be making a lot of good estrogen, but you may not be getting rid of it in a timely way. So your estrogen levels go up, and that makes you more susceptible to estrogen-related cancers. You can look at mitochondria. Mitochondria are the little powerhouses inside the cells that give us energy. You can look at genes related to Alzheimer's disease and cardiovascular disease. These are genes that look at your immune system, your immunoglobulins, clotting factors, celiac disease, thyroid disease, eye health, and other immune factors. So in my mind, the more of this you have, the better able you are to determine what kind of health problems that you need to address. And this is just kind of repeating this idea that you need to sort of know what these genes are all about, what they're doing. Remember the difference in the rats. Well, the difference in the rats is this whole epigenetics, right? It's what they were fed, how they lived their lives. So if you get a test that says, well, you've got this and this and this gene that are messed up, don't you want to know what to do about it? And the best reports will give you that information. They'll say, you need to be avoiding estrogen because you're not breaking down estrogen very well. You need to be taking certain vitamins that help you break it down better. And there's numerous other examples along those lines. Basically, you're back to our original idea here. You want to be an epigenetic practitioner. You want to say, well, yeah, I was born with these genes, but what can I do to nurture those genes and make them work better? This is just an example of what you might see in a report. So for instance, DAO, and you don't have to remember this or anything, but just as an example. DAO is an enzyme that breaks down histamine. So we all know that too much histamine is bad for us. We know that you can buy antihistamines in the drugstore. This particular enzyme that's coded by a gene, remember it's gene enzyme function, right? So this particular gene enzyme is coding to make this this enzyme that breaks down histamine. If you're weak here, and red indicates this person is weak there, then they may be having symptoms as if they're having allergies. They're eating foods and they're giving them stress because they're not breaking down. This enzyme is building up in their body. Another example, this gene enzyme is turning glutamate into GABA. Well, glutamate is a neurotoxin. GABA is a neurotransmitter that has a calming influence. So this gene turns glutamate into GABA if it's working well. If it's not working well, the person's going to get an accumulation there and not get enough there. And these are other examples. This one has to do with folate. So in our histamine example, so if you're a person who's not breaking down histamine, well, here's histamine. Histamine doesn't just make your nose runny and your eyes itch. It has all of these effects in your body. It can go into your nervous system, cause headaches, vertigo, hypertension. It can go into your cardiovascular system and cause arrhythmias, and definitely it can go into the skin. So here's a person who's eating foods they're not technically allergic to, but they're not breaking down their histamine. And so what's happening when they eat those foods is they're getting a flushing reaction, they're getting itching, pruritus, they're getting a rash, and it's not strictly speaking a real, this can be kind of a differentiation. If a person is eating a food that they're allergic to, let's again use the example of wheat because it's so common. So whenever they eat wheat, they're going to get a reaction. And that's pretty obviously how you would diagnose that. But what about this person who gets a reaction from wheat, but also from dairy, and also from pickles, on all kinds of different foods? Well, that person doesn't have, I'm sure there's a better way to do this, but I'm not that good. That person doesn't really have an allergy to all of those foods. They're just not breaking down their histamine, and it's giving them these histamine kind of reactions throughout their body. Or maybe it's tearing up their digestive tract, or maybe it's causing some problems with their bone marrow. And this is just a blow up of the same kind of thing. This is a detoxification gene. If you actually went and counted up the number of genes you have in your body, you probably have more genes that has to do with detoxification functions than any other function in your body. To me, that gives me the message that says detoxification is important. We've got a lot of genes that we're trying to detoxify and get stuff out of our world. So this CYP gene category is doing that, and also has some effects on cholesterol and vitamin D and some other things at the same time. So this is the kind of thing you would see in a really good test. You'd see an explanation in your report of whether you were having a problem with the gene, what that gene did, and then what kind of things that you could do to change that. What you can do to nurture your genetic nature. And this goes back to, again, what I talked about at the beginning, this detoxification, nutrition, activity. Those are your DNA that helps you support your DNA. If you are making too many neurotransmitters, let's say you're making too many stress hormones, you've got a geared up stress system. It's making you more anxious. It's making you have a difficulty sleeping. Well, that's under genetic control. What can you do epigenetically to change that? Well, one thing is to sort of say, hey, I'm going to make sure that I'm doing things in my life like meditation or going out in the woods or exercising, doing things that help me relax and counterbalance this excessive amount. So when somebody's under a lot of stress, again, remember our slide earlier about inflammation and oxidation, stress increases that. So when people talk about, gee, my skin looks terrible, and they're living this really, really stressful life, well, you think, wow, they're producing a lot of stress hormones and causing this oxidative damage, which is manifesting on their skin. And of course, inside them also. Just to kind of talk about, treatment examples. So we talked about a person who doesn't break down histamine. Well, that person will need to avoid NSAIDs, which are the non-inflammatory anti-inflammatories, and they'll need to avoid foods that are high in histamine. So in the report, we have a list of foods that are high in histamine, such as fermented foods and alcohol will release a lot of histamine in the body. We know that vitamin B6 and C are cofactors. So remember we talked about how if you want to do a process in the body, the enzymes rely on these cofactors. Well, in this case, the cofactors are vitamin C and B6. So sometimes you can stop that person from having their histamine reaction by just supplying them with more vitamin B6 and C. And then in extreme cases, you can actually buy an enzyme. This enzyme is not a typical digestive enzyme. It's actually specifically made for breaking down histamine in the body. So, and another example would be a pretty common one actually is folate. We don't always process folate very well. And we've got actually dozens of genes that affect the amount of folate. Folate is a B vitamin. And so if you have a poor genetics here, then you'd want to eat a diet that was really rich in those folates, which is green leafy vegetables. You want to have a low stress lifestyle. This is a particularly, like I say, prominent one. And you think, well, God, here's this very simple little B vitamin. But it's been associated with depression, insomnia, bipolar disease, anorexia, erectile dysfunction, thyroid disorders, and miscarriages. I didn't list that on here. There's actually quite a long list of health problems that are associated with not having enough folate. So here again, you get the genetic epigenetics. Let's say if you have really rotten genetics for folate, and you're also eating a really low folate diet, not getting much green leafy vegetables, and leading a very stressful life, then you might be manifesting with diseases. On the other hand, if you take genetic control and start eating more, epigenetic control, and you start eating more green leafy vegetables, add more, meditation and de-stressing kinds of activities, then you can counterbalance this folate genetic problem. And you may want to take folate pills too. But you do not want to take folic acid. So folic acid is what is in most vitamin supplements, prenatal vitamins. That will actually make you worse. Folate is the active form of this vitamin. Folic acid is the non-active form. And then our standard disclaimer here is, of course, always to talk to your practitioner or talk to somebody who has a knowledge of genetics when you're setting up a plan and how to deal with your factors. So things that when people say, well, how do I know if a report is good or bad? Well, I tell people, stay away from reports. And this is actually the most common kind of report. These reports you may have read articles in the paper about. A journalist goes to such and such a company and they do their genetics and they tell them that they have a 20% increased risk of Alzheimer's disease and a 10% increase in diabetes, and et cetera, et cetera. Those tests are absolutely, well, I wouldn't say absolutely, but for the most part, really bogus. Why? Because of everything we've talked about today. There's all of this epigenetic control. So what if you have a whole family of bad genes for Alzheimer's disease if you're taking care of your brain? The other problem with this is that we don't know all of the genes. This is very early on in this research. It's going to take us number of more years to know all of the genes that have to do with ADHD or Alzheimer's or diabetes or anything. The other problem with this kind of testing is that most of the research, unfortunately, that's being done is around drugs. So when they're looking at the drugs and manipulation of genes, so when researchers are saying, well, let's find all of the genes that have to do with Alzheimer's disease, because we're going to cure this disease, well, they're looking for that from the standpoint of what can we do to manipulate this gene? They want to come up with some magic, highly technical, either drug or genetic manipulation to change how that gene is being expressed. And therefore, they have to limit the number of genes they're looking at. But we know that there's probably dozens, maybe even hundreds of genes that affect these disorders. There's very few diseases that are one gene, one disease. Mostly you have dozens and hundreds of genes that are affecting that disease. The other thing that will come out in these newspaper articles when somebody's done one of these tests is they'll look at the test and they'll say, well, gee, I have a 20% chance of this and a 40% chance of this. And then the punchline is already, well, I knew that already because I could just look at my family. So I didn't need to do my genetic test to know that there's a lot of cancer in my family. And then you have all of these peripheral influences, what I call peripheral influences. So you may have diabetes, let's say you have diabetes, you get all this genetics for diabetes. Well, how you process vitamin A will also affect your diabetes, but they're not even looking at that. We eat foods that are high in carotenes. Carotenes don't do us any good. We have to convert the carotenes into vitamin A in order to get that effect in our bodies, and that's under genetic control. So if you are eating a lot of carotenes and no vitamin A, and you got really poor genes, then you're going to have poor vitamin A function, which is going to affect things like Alzheimer's disease and diabetes and all these other diseases. Not directly, but indirectly, it's going to make them, for instance, have more side effects, more complications. So you're looking at oxidative tests, and a lot of these things can be tested for. You can test for vitamin D, you can test for oxidative stress, you can do some of this kind of testing to find out just how well your genes are working. Wow, how did I do for time? Not bad. So we're going to pause now and have some questions. If you're interested in knowing more about this is my website, www.naturaldna-solutions. I also have a YouTube channel, and I have a number of videos about genetics. And if this video turned out today, I might have this lecture on there too. If you're interested in a DNA report, send me an email, and I will let me know you saw me today, and I'll offer you a discount on a DNA report, and that's at naturaldnasolutions@gmail.com. Thank you.